Hi everyone, my name is Jason, and today we're going to be talking about a patient in London. Let's call him Bob. Bob was suffering from Hodgkin's disease and also tested positive for HIV-1. He had undergone a hematopoietic stem cell transplant, which involves infusion of allogenic stem cells via bone marrow from a donor. This is a common therapy for Hodgkin's disease, in which the expected outcome is for the patient's immune system to begin rebuilding. The transplant was a success. Months after the transplant, while running routine diagnostics, the doctors noticed how Bob's HIV viral load had reduced, and his white blood cell count began to slowly increase, suggesting that he had been cured of the virus. So what happened? HIV is something I'm sure everyone has heard of. In particular, I'll be focusing on HIV-1, which is the most common type of human immunodeficiency virus. HIV-1 attacks a person's immune system, destroying white blood cells, leaving them more vulnerable to other diseases and infections. The virus attaches to the CCR5 receptor on T cells, effectively leaving the cell helpless. There is no known cure. However, there is. About 20 years ago, a genetic mutation was discovered called CCR5 delta 32. This mutation disables the CCR5 receptor, meaning the virus is unable to bind to the T cell, leaving the immune system immune to the virus. There is no known origin for this mutation. However, it is thought to have originated from Europe. It is estimated only about 2% of the world population have this mutation. So it turns out the stem cell donor had this genetic mutation. After the transplant, the genetic code of the donor had been integrated into Bob's DNA, resulting in the CCR5 mutation, meaning that HIV virus was unable to attack the host cell's white blood cells. This patient had been in HIV-1 remission for 30 months, with no detectable replication competent viruses in blood, intestinal tissue, or lymphoid tissue. According to mathematical modeling, the patient is now more than 99% cured of the virus. HIV is a viral infection affecting 1.1 million people just in the US alone. This biological breakthrough is a large step for the industry of medicine and will only expand in the future to save more lives. The new question is whether this genetic therapy can be applied to other diseases that affect lives of people every day.